Hey y'all, happy Wednesday. You know, Wednesdays we do Work It Out Wednesday. And this week, since we're talking about the ACC and AHA guidelines, I wanted to give you a practice question pertaining to that. So, from my review book, it states Mr. Maurice is a 55-year-old male who presents for follow up today. His blood pressure is 146/98. He has a history of hyperlipidemia and diabetes. What is the goal blood pressure for this patient? Again, I always tell y'all to look at the stem of the question first. So the stem states, what is the goal blood pressure for this patient? So this is a male. He came in, his blood pressure is 146/98. He has a history of hyperlipidemia and diabetes. So I want y'all to remember what ACC and AHA guidelines talk about, and I'll get into that in a second, but let me read you the answer choices. First choice is A, 140/90, B, 130/80, C, 150/90, or D, none of the above. Okay? So with ACC and AHA guidelines, we no longer look at the patient's age. We look at their blood pressure and what's going on with them, okay? Right? So in this scenario, and I know I'm doing a little bit quicker before you were able to think or answer and maybe put it in your head, but I just wanted to kind of go through this question this time. But we're looking for the goal blood pressure for this person, and we got to think about it. So ACC and AHA guidelines state that we need to have certain goals for those as our standard, those who are healthy, and those who have comorbidities, right? So standard 120/80 is the normal. If it's above that, we're going to consider them as pre-hypertensive. And we start having them do lifestyle modifications such as the DASH diet and exercising 5 days a week for 30 minutes each of those days. Next, if they have comorbidities, I don't care what they are, but any comorbidities, we don't want their blood pressure to be any greater than 130/80, right? Because if you already have those risk factors, you don't want anything to be greater, right? Because hypertension will just add on to your cardiovascular risk factors. And then lastly, for our healthy population, we don't want them to be anywhere above 140/90. So if they get above the goal, we initiate therapy then. We start providing medication treatment for those above that 130/80 and that 140/90. And we follow the same thing we did with JNC 8 for treatment, but we don't use the JNC guidelines as far as treating them based on their age, etc. Okay? So we still have our thiazides as first-line therapy, and etc., etc. If they're African American, we treat with thiazides and calcium channel blockers. If they have chronic kidney disease or diabetes, we use our ACEs and our ARBs in that fashion, okay? So in this scenario, Mr. Maurice is 55. He presents today. His blood pressure, he's following up, y'all. So his blood pressure is 146/98. And he has a history of hyperlipidemia and diabetes. So what? He has comorbidities. So his blood pressure should be less than 130/80. So the question asks, the stem states, what is the goal blood pressure for this patient? And it should be B, 130/80. We wanted that or less than, okay? All right, you guys, meet me back here next Wednesday. I hope y'all found this helpful. Y'all continue to study. Whatever you can do each day will be beneficial. But follow the Nursing Studio. Bring your friends and coworkers and colleagues along if they can benefit from this. And meet me back here next week. All right. Good night. Bye.